Magandang umaga po. Isa nga po ito sa nabanggit ni Presidente Aquino, itong sa universal healthcare. Sa ngayon po ba, ilang porsyento na po sa more than 90 million ang members ng Philhealth? Kasi sa pagkakaalam ko, parang 2 beses na yata nagkaroon ng malawakang registration ang Philhealth po.
Ganito, magandang tanong talaga yan. I always love it. Okay, part of our problem, answering the question you ask, is that Philhealth is family membership. Okay, unlike other schemes where you're basically a member as an individual, that means you come in as the principal or the dependent. In Philhealth, you're a family. The membership is family. So, si Greg, asawa niya, tatay niya more than 60, nanay niya, anak less than 21, kahit illegitimate child less than 21, kasama. If he's a Muslim, kahit yung 2, 3, 4 na asawa niya, counted up to the 4th, no? So the nature of membership probably would already show why having that count is difficult. Historically po, what Philhealth used to do was simply come out with multipliers. That means they count the number of members, then they multiply that with estimated family size. And that became, I think, a source of problem, particularly when surveys, and the particular survey we're talking about, the National Demographic Health Survey, came with a different number. Because when you ask the survey question, you usually underestimate, usually there's an undercount in the response. But medyo malayo yung agwat. So what have we done now in Philhealth? Sorry, I have to give a long answer. So the instructions is, we try to avoid now multipliers. So as much as possible, the way we're doing it, we're head counting. That means we're actually counting the member plus the dependent in the database. And so we have that data for the formal sector, we have that for the individually paying, and we have that for half of the sponsored program. Now, for the other half, which is the LGU-sponsored, the data is not that clean. So we're still in the process of really doing the head counting. Okay. And I think we're also missing a substantial chunk of what I call the 21 to 40 years old, single, young Filipinos, Filipinas, na mahirap i-capture to eh. Kasi they're usually working informal sector, di ba? Medical students, kasi dapat membro na to. So roughly, we have we sort of the estimate we have, I think right now is roughly about around a range of 75 to 80%. Okay. Of course, we also, but the problem also when you do that is, do we have the right denominator? So what's the population of the Philippines talaga? Is it 93, 90? Because your denominator will affect what the percentage is. So if you want a better number, I'll say our head count of members is about 26.6 million, which we can probably estimate to which, based on our head counting and some estimation, translates to about 74 million Filipinos. Assuming 93 million total population, then you get your percentage. So you can just do the numbers. But the cleanest number, yung pinakamalinis na numero sa data na yan, would be the 26.6 million members. Yun yung nagbabayad. Diba? They can be families, they can be individuals, but 26.6 million paying members, which because of the family membership nature, roughly translates to about 74 million members plus dependents. But it's there's a substantial number of assumptions for that number. So it has to be kumbaga plus minus. That's how we treat it.
At least sa estimate po, medyo malaki na
80% I think. But which is of course going to be challenged because I understand that there's a survey that was done in 2011 by NSO which shows a lower number. And so we would have to explain ourselves again once those number comes out. I think the numbers that comes from the survey is about 20-25% less. But we'll see. For us kasi, we look at these numbers not as numbers to brag about, but just numbers that there's much more work for us to be done. At the end of the day, remember our slogan about Filipino. So anything less than 100% dapat hindi acceptable. So we really have to go for 100%. Or even if we don't hit it, try doing 100%.
Oo. medyo malapit-lapit na po na sa ganyan. Nabanggit nyo rin po na ito sa national, yung mga under ng National Household Targeting System, ito ay gagastusan ng ating national government. Ito pong, ano ba to? 3.7 million?
No, no po, lampas po yan. Ganito po yan. Ah, yung National Household Targeting System, hindi ko alam kung familiar po kayo dito, no? Pero ang gobyerno, led by the Department of Social Welfare and Development, ay halos 2-3 taon na po sinusuyod yung buong Pilipinas at talagang nagko-conduct ng isang tinatawag na proxy means test. Ang official name is the National Household Targeting System for Poverty Reduction. And at halos, lampas na po, sa alam ko, halos 18 million na eh. Halos 18 million na po ng mga pamamahay ang napuntahan nila at tinignan at inassess. At napasok na po sa isang database ito ng DSWD. Now, based po diyan sa mga na-assess nila, approximately 5.2 million families, milyong pamilya ang na-determine na mahirap. Mayroon pong cut-off ginamit ang DSWD. I think equivalent po to sa poverty cut-off. Ang ginawa na po natin, ng gobyerno natin, ay yung 5.2 million na to ay bayad po ang kanilang premium ng national government. Halos 12 billion po to. Okay? 12 billion po to. Hindi po to 3.8 billion. Kasi ang premium po nito is 2,400. And so, yung sa 2012 budget po, 12 billion to ang binayad po nila. So, billion. So ngayon po, ang ginagawa namin is sinisigurado natin, inaalagaan talaga natin itong mga pamilyang to. So kausap po namin, may joint order lang po kami, no? Hindi ko alam kung binubuo, pinirman ko yung sa side ng Philhealth, malamang DSWD, no? Na talagang nagtutulungan po kami ngayon closely sa DSWD to make sure na itong mga pamilyang to ay would avail of their benefits.
I understand po na ito yung karamihan dito ay yung mga beneficiary din ng 4Ps.
Ganito po yan eh. Ang 4Ps na programa, allow me po to explain a bit, no? At medyo pamilyar ako sa programang yan. Sa 5.2 million households na yan, no? Ang 4Ps kasi ay kumbaga conditional cash transfer, di ba? Based on certain conditions. So, tinitignan nila ngayon sa 5.2 million na yan kung sino sa pamilyang yan would be eligible sa cash transfer na yan. Ibig sabihin, may bata less than 14 years old. May buntis. Kung wala kayong buntis, walang less than 14 years old, hindi ka pwede masama sa 4Ps. At sa alam ko, sa ngayon, I think ang eligible sa 5.2 million is roughly about just over 3 million. So, ibig sabihin, ang 4Ps ay just a subset of the NHTS. Now, may ilang pamilya yata doon, ilang libo lang naman na medyo on the ground, medyo nagpalit, nag-replace. Pero generally, yung listahan po ng 4Ps ay sa loob yan ng listahan ng mga mahirap as determined by the NHTS. So automatic na rin yan. Ang na-covered namin po ang 4Ps family.
Okay, Cathy Cruz.
Thank you po.
Good morning po sa inyong lahat.
Good morning po.
First question ko po, ang SSS po kasi nag-conduct po sila o naglabas sila ng Universal Membership ID. So I understand that na yung dun sa UMID na tinatawag nila, ay kaakibat din po ang Philhealth doon. Yung Philhealth, GSIS, and SSS. So ano na po ba ang estado ng pag-uugnayan po ng SSS at ng Philhealth dito? At ano po ang, kumbaga ilan na po as of today yung nailabas ninyo na ID? At ano pong ginagawa ninyo for those members who have already existing Philhealth ID?
Ganito po. Magandang umaga po sa inyo. Gusto ko yung tanong na yan eh. Kaibigan, ang SSS nakaupo sa board of Philhealth, no? Sa punto po ng UMID, ang UMID po kasi ay isang pamamaraan na ginawa po simulan nga ng dating administrasyon, no? Na para, kasi wala nga national ID system ang Pilipinas, no? So lahat po ng mga institusyon na nagbibigay ng ID para nag-uusap nagsama-sama. Sa ngayon po, tuloy pong pag-uusap namin sa SSS, no? Tungkol sa kung paano to move forward with UMID. I think at this stage, the level of details, hindi ko po masagot, no? Philhealth hasn't really released any UMID type of cards. Frankly, it's too expensive. I find it a bit expensive. 280 pesos is a bit expensive. Medyo mahal po yan eh. Alam mo naman, sanay lang ako hanggang 100 na pong kaya kong bilangin eh. So, But that discussions po with SSS is ongoing. I think eventually there will be much more better clarity in the future. At this stage po, I don't think I could provide an answer po to your question on that. But clearly, I think po ang mas importante natin intindihin, maintindihan is that at the end of the day, ang Philhealth po talaga may pinakalawak na obligasyon on membership. Kasi kung titignan niyo po, ang GSIS only covers about 1.4 million eh. Kasi hindi kasama po yung yung uniform services eh. 'Di ba? Hiwala yung uniform services eh. So that's under the AFP or the PNP schemes. So 1.4 million. Ang SSS is, well, it's basically the rest, no? But the extent of penetration of SSS membership for the poor is probably not at the level of our penetration. And of course, at pangatlo, the way we deal with dependents is mas malalim. Because in SSS, it's basically member, then the dependence is just like somebody who gets the money if something happens. But in Philhealth, once you're dependent, you get admitted, you're part of the system. So really, if there's an agency, no, if there's any government agency po ngayon na talagang kailangan po ng magandang database ng all Filipinos, kami po. Kasi obligasyon namin po really to cover all Filipinos. So any scheme that will simplify our life in getting identification cards and all of that is nice for us. And so if SSS can take care of let's say, of their membership, so we don't have to worry about identification cards there, we would love that to happen. But as I said, yun nga, the discussions with UMID is still ongoing. Then we'll probably we'll see po in the next few months. Mr. Diquiros naman is a wonderful friend. So nag-uusap naman po kami.
Okay, thank you, sir. My another question is, how many hospitals are accredited by Philhealth nationwide? And anong ginagawa ninyo doon sa mga hospitals na hindi pa accredited ng Philhealth? Siyempre, apektado po kasi yung mga Pilipino, kababayan natin na naipasok doon sa mga hospitals na hindi pa po accredited.
Ay, talagang may ginawa po kami. As of April ba? April 1. As of April 1 po, pag lisensyado ka ng DOH, you're already considered accredited. But you have to sign a contract with Philhealth. Kasi nagbabayad kami. So yung proseso na medyo pahirapan pa, na kailangan ka-inspeksyonin ulit ng Philhealth, pawala na po yan. We are in a transition period. Okay? Kasi the order came out, lumabas lang po sa dyaryo 3 days ago eh. Medyo mahaba eh. Kung hanapin niyo po Philippine Star, ito yung 2 pages namin pinalabas. Ng title po dito, The New Provider Engagement Policy of Philhealth. Basically, what it means is this. If you are licensed by DOH, we accept that already as equivalent to Center of Safety. And you can walk to any Philhealth office with that license, Center of Safety, then say, can I sign a performance commitment contract? Now, if you are not happy with the performance commitment contract, ibang usapan yan. Hindi naman pwede tayong magbayad na gusto nila bayaran ng kahit ano, di ba? It takes two to tango. Sometimes you have to tell the hospitals, you have obligations, you have commitments, it takes two to tango. We are simplifying our process, but you also have to agree to rules, including quality, including keeping your books and all of that. So, we have done our part po. Whatever, as of now po, of course, the numbers is less than that's licensed, di ba? But what's important for us is any licensed hospital can walk in anytime. So I think let's talk about the future than what is now.
Okay.